Hello, my name is Elizabeth Borda Cardona. This is my presentation on the respiratory system from a physical perspective, focusing on the laws of fluid mechanics and respiratory disorders. This topic is important for understanding how gases behave within our bodies and how they are affected by different diseases. Fluid mechanics is a branch of physics that studies how liquids and gases behave. In the respiratory system, this helps us understand how air moves in and out of the lungs. First, boil levels stay at constant temperature. As the volume of a gas increases, its pressure decreases and vice versa. This is fundamental to breathe when the lung expands to pressure drop and air enters. Ohm's law, as applied to the respiratory system, relates airflow Q to pressure differential P and resistance R. That is, Q equal P slash R. If airway resistance increases, as in asthma, airflow decreases. To understand the transport of gas in our body, we can divide the process into 5 subsystems. First, ventilation. It is the movement of air that enters and leaves the lungs thanks to the work of the respiratory muscle. Two, external respiration. It is the exchange of oxygen and carbon dioxide between the alveoli and the blood in the pulmonary capillaries. Transport. It is the displacement of gas throughout the blood. Oxygen is transported bound to hemoglobin and CO2 is also in part transported as bicarbonate. Internal breathing, it is the exchange of gas between the blood on tissue cells. And cellular respiration, it is the process in which cells use oxygen to produce energy and release carbon dioxide as waste. There are different types of respiratory disorders. In obstructive disorders such as asthma or COPD, the airways are narrowed or blocked, which increases resistance and decreases airflow. In restricted disorders such as pulmonary fibrosis, the lungs cannot fully expand. This reduces the total volume of air, although the flow may be normal at first. And max disorders combine both difficulty expanding the lungs and getting air to circulate from the airways. Like helps us understand the disorders if we think of the respiratory system as a circuit. Airflow is like current, pressure is like voltage, and resistance is prevent air from passing through. In asthma, for example, the resistance increases and although the pressure generated by the respiratory muscles is the same, the airflow decreases, causing difficulty breathing. Spirometry is a test to evaluate lung function. The forced vital capacity is the total volume of air that can be exhaled after a deep inhalation. The forced expiration volume in the first second, PaV1, is the volume that is exhaled in the first second. If one FBC is less than 70%, it indicates an obstruction, as in COPD a normal value is between 75% and 8%. Are some other important values. The PAF is the maximum flow at the beginning of expiration. It is widely used in asthma control. The if 25 and 75% indicates flow during the middle part of expiration and detects small obstructions. The total respiratory time is normally 4 to 6 seconds. If it lasts longer, there may be an obstruction, as in severe COPD. The Haldane effect is a phenomenon that helps eliminate CO2 from the body. When hemoglobin binds to oxygen in the lungs, it releases the carbon dioxide it weighs carrying. Thank you for your attention. I hope that this presentation had helped you to better understand how the respiratory system works from physics and how these processes are affected in the different disorders. Thank you.